gotcha.
Yes.
This is what I've been doing. Do it like this, right?
Hey guys, Dr. Nick here. I'm here with Dr. Brady. We're at Kalkstein Chiropractic. We're gonna run through a treatment plan here for Dr. Brady. He's what do you do? Spartan races?
Spartan races, yeah.
He's very athletic. He's got a marathon coming out in October. Him and Dr. Warren are gonna partake in. But Dr. Brady has, what is it, L5?
L5S1, yep.
Left paracentral disc herniation.
Nice.
So he's in a lot of pain, and we're gonna get him fixed up. We're gonna get him moving better for the race in October. So, walk you through what we're gonna do for him here. Already did a quick exam on him. He's very limited in his range of motion. He really doesn't like to go into forward flexion. That really spikes the pain, especially in that left glute there. So, we're gonna take it easy on him. But first off, let's get him adjusted.
Do it. I hear Dr. Nick might be doing the marathon this year as well.
Not a chance.
There's been rumblings.
Not a chance I do a marathon. I don't think there's ever been a point in my life where I've ran more than 6 miles in one sitting.
Well, they have a 10K, I think.
I don't think you realized the last time I ran, Brady. Probably in undergrad. Alright, little pressure through here first, right?
Okay.
Big breath. All the way out. One more breath in for me. All the way. Good. A little bit more.
Yes.
Alright, start left side up for me.
If you want to get a close up on the Patrick and SpongeBob socks, you're allowed to.
Definitely.
You're flexible. Stack right there.
Okay.
Let that hip drop towards me. Good. Breath in. Good. Let it out. Let that hip fall. I got you.
Yes.
Good. On your back. Brady really only likes to move to the left a little bit, so we're going to stick with only adjusting the left side until he gets a little less neural tension on him. He can, go ahead and set this way for me. So what we mean by neural tension is, Brady, go ahead, keep both legs straight, try to bend forward. So he gets pretty locked up, but if you were to reset, come on, and then bend that right side for us, and then go down like you were doing for the left side, yeah. Yeah, you can get a lot farther once he puts slack in that nerve. So once he starts to move a little better, we'll start to address both sides, but for now we're just gonna stick that left side. So going forward, we're gonna start him with traction, then dry needling, and we'll show you guys his at-home stuff that he should be doing.
And I will. Hey everybody, it's Dr. Brady here again, and today we are going over spinal decompression for my disc bulge at my L5S1 nerve root. So right here is a normal looking spine. As you can see, a lot of disc space here. Basically there's no compression on these spinal nerves that exit out of these foramen right here. And then what we have here is a spine that unfortunately has a disc protrusion. So what happens here is that disc protrudes and leaks out of that annulus fibrosus, and that jelly donut per se comes out and then sometimes compresses on those spinal nerves right there. So what decompression therapy does is we will traction out the spine just like this, thus taking pressure off of that nerve root right there. So you should have relief pretty much instantaneously for the time being when you're on traction, because it's taking pressure off of this nerve root right here. And some other good things that spinal decompression does is it helps rehydrate that disc. As the disc separates, blood flow and other nutrients go right inside of that disc to help heal in that process. So I have Sabrina here that's going to set me up and show me how we do spinal decompression here at the office.
Yes.
How are we doing, Sabrina?
Doing great. How are you?
Good. I didn't lose my spine today. Pretty good.
Alrighty. Start from the top. Okay, deep breath in for me. Deep breath out. Is that tight enough for you?
Yes, that's good.
Okay, lift your hips up. Same thing. Deep breath in, deep breath out.
Oh yeah. Sabrina's strong.
Oh yeah. Eat your veggies.
Yep.
That's how you get strong.
That's right. Sabrina's also a volleyball player.
Yes, fellow volleyball players here. Gotta really crank them in here.
There's no way I'm getting out of this.
No, not at all. This is the funny part. Get her.
So Sabrina, what are you actually doing here?
I am connecting you to the machine that tugs on you.
Okay. Gotcha.
Trying to get it nice and even so that we get a good pull. Looks perfect to me.
Nice.
Give you
Feels
your
good.
emergency button in case you want to run away.
Thank you, thank you.
To unlock that table so you can actually get that pull. And we're all set up.
Awesome.
Yeah, nice
Thank
settings.
you, Sabrina.
You're so welcome, Dr. Brady.
DT plus 30. If you could.
DT plus 30, I got you.
Alrighty, Dr. Brady. So what we're going to do is you're going to bring this knee up. You're going to pin that to your chest with your hands. So go ahead and grip underneath your knee and pin that up right there. From there, you're going to bring your ankle into dorsiflexion. So think of toes to the nose. So you're going to keep that here. And from here, I want you to slowly extend as far as you can get. And once you get to that point, I want you to pump that foot 3 times.
This is what I've been doing. Do it like this, right?
From here, we'll end with the toes to the nose, and we'll bring it back down in that motion while keeping that dorsiflexion of the ankle. And then we're just going to repeat this 9 more times. Take a deep breath. Breathe out.
Just 1 second.
I do that. SpongeBob and Patrick are loving this.
Take another deep breath in and out.
All right, everybody. That's the wrap up here for how we treat a lumbar disc here in the office. So the adjustment, the dry needling, traction therapy, and then this is my at-home exercises. Christian's just helping me out just to get a little bit more of range of motion on this nerve floss here. So thanks for watching, guys, and look forward to the videos in the future.